Hi, my name is Dr. Tiffany Zigras, and I'm excited to share some important updates with you on the frequency of HPV testing as we move towards the launch of primary HPV testing in March 2025. With the initiation of primary HPV testing, the new interval for cervical screening will be every 5 years for those who have a negative HPV test. We know this is safe because the HPV test is more sensitive than the previous Pap testing that we were doing. Because it's a more reliable test, it can be done less often. We also know that it takes well over 10 years from an individual to go from having an HPV infection to developing a cervical cancer. If your patient decides that they would like to have another HPV test within the 5 years, they will be required to pay for the test. It's also important to note that any testing done that is self-pay is outside of the Ontario Cervical Screening Program. And because of this, they will not get the mailed letter as part of the Ontario Cervical Screening Program, which provides them with the result. For those patients who have a high-risk HPV test that is 16 and 18/45 negative, but positive for one of the other high-risk strains, the management is dependent on the cytology. If the cytology has any high-grade finding, they need an immediate referral to colposcopy. We covered this in one of our previous videos. You can see the link below. If the cytology result is negative for any intraepithelial lesion or shows ascus or LSIL, these individuals can safely have their HPV test repeated in 2 years. If at that 2-year mark they still have a positive HPV test, at that point they will need to be referred to colposcopy. However, if at that point when you repeat the test in 2 years, if the test is now negative for HPV, those individuals can safely return to cervical screening every 5 years. Stay tuned for more updates as we approach March 2025. And if you have any questions, please feel free to reach out to me. We're very excited to embark on this journey with you.